Welcome to the Paradise Valley, Peoria, Deer Valley Informed Consent video. It's required viewing for all student athletes and their parents or guardians. We want your consent to be based upon understanding both the benefits and the risk of participation. And we want you to know what you can do to reduce that risk. This video is intended to make you aware of the balance between benefits and the risk you take, the nature and magnitude of the risk, the likelihood that you will suffer a significant sports injury, and your role in reducing that risk you take.
Research shows that participation in extracurricular activities produces substantial benefit, including improved academic performance, better attendance, and fewer behavioral problems, particularly during periods of participation. Student athletes also learn valuable lessons of teamwork and self-discipline. The American College Testing Services, ACT, found that one measure for predicting success in life was achievement in school activities as well as academics. Most importantly, by participating in interscholastic activities, you are more likely to stay in school, graduate, and experience greater enjoyment from your high school experience.
In addition to the physical benefits, there are mental and emotional rewards from athletic participation. We want athletes to improve physically, but also grow psychologically and socially, and learn personal responsibility and accountability.
Psychologists tell us injury risk is an important factor in the personal development of student athletes. We also know that sports require focus, commitment, and attention to details by each participant.
We provide many opportunities for athletes to improve their strength and conditioning and to learn the rules and fundamentals of their sport, but much of the responsibility for improvement lies with the individual athletes. The same is true of protecting themselves from injuries.
Students have many options for extracurricular participations. Sports is just one of those, and within the overall athletics program, we offer numerous sports choices, some more risky than others. In choosing sports participation, you'll face certain injury risk. Our coaches stress safe participation, and our licensed athletic trainers are uniquely qualified to address health and safety issues in sports. But athletes and their parents or guardians must also take responsibility for reducing their own injury risks.
Risk of injury is inherent in sports. Most high school athletes sustain some type of injury during their career, but many of these injuries are not significant. Most common injuries like blisters, abrasions, contusions, minor lacerations, and muscle cramps or spasms are often quickly treated by the athletic trainer, allowing the athlete to immediately resume activity. You must, however, report every injury to your athletic trainer. Seemingly insignificant injuries can result in serious problems due to infection and other potential complications if they do not receive proper treatment. A study by the National Athletic Trainers Association revealed that only about 1/3 of all athletes suffer time loss injuries, which is an injury that keeps the athlete from participating in at least one practice or competition. However, since there is no way to predict which athletes will become injured, the risk of injury will be present during every minute of your participation, both in practice and competition.
You must constantly focus on doing what is necessary to reduce your risk of harm. Anytime you think you may have been injured, immediately report it to your athletic trainer. If the athletic trainer is not available, report the problem to your coach and then see the athletic trainer as soon as possible.
The NATA study divided injuries into 3 categories. Minor injuries result in a loss of participation for 1 to 7 days. Moderate injuries cause the athlete to miss 8 to 20 days, and major injuries result in the athlete missing 3 weeks or more. Approximately 75% of the reported injuries were minor, 15% were moderate, and only about 10% were major. Catastrophic injuries, which we'll discuss later, are very rare. When an injury first occurs, we don't know how long it will take to recover. The time required often depends upon athletes' willingness to follow the medical guidance. The NATA study found that 10% of the injuries were re-injuries, which can often be avoided by following the recommendations of your athletic trainer. Even injuries which keep you out of activity a week or less can have long-term consequences. If a mild sprain is properly treated, you may return to activity in a few days, but later in life, joints can develop significant arthritic changes due to minor injuries in high school.
The most common injuries are to the musculoskeletal system. Sprains are injuries to joints, strains involve muscles and tendons, and about 7% of sports injuries are fractures. Time to return to activity varies from player to player and injury to injury. If you attempt to return before your physician and athletic trainer believe you are ready, you are much more susceptible to re-injury.
About 2% of sports injuries require surgery. In most cases, surgery will require you to miss more than 3 weeks of activity and have a long period of rehabilitation. Surgical repair of the knees and other joints may also leave you at risk for arthritis later in life.
Most surgeries result from knee injuries, girls basketball players being the most likely to require such surgery. In sports involving both boys and girls teams, girls are more likely than boys to suffer knee injuries. Injuries to the back and neck are not common, but do occur during sports activities. They often result from poor techniques either during sports activity or strength training. You can have serious consequences including arthritis, bulging discs, and damage to nerves in the neck and low back. Following coach's instructions reduces the risk of these injuries.
Occasionally, athletes injure vital organs such as the lungs, spleen, liver, kidneys, and reproductive organs. These can be very serious, involve an extended recovery period, and require surgery. Any intense pain in your chest, abdomen, or pelvic area requires immediate medical attention.
We've always been concerned about concussions, but in recent years our focus has increased. We're fortunate in our community to have a nationally renowned expert on concussions in high school sports who can provide special insight into this problem.
Most concussions don't involve loss of consciousness, but that doesn't mean the injury isn't significant. Never take a concussion lightly, and avoid terms like he was dinged or she had her bell rung. Those dings and bells are concussions.
5 to 10% of athletes sustain concussions. After football, the second highest rate of concussions is in girls soccer and cheerleading. In sports common to both girls and boys, girls are more likely to sustain a concussion than boys.
It is obvious to us that a concussion has occurred if we see an athlete appearing dazed, confused, or unsteady on her feet. Often, however, symptoms are more subtle, and we have to rely on the affected athlete or his teammates to let us know there is a problem.
Concussions can have serious and sometimes life-changing consequences, especially if they are not managed properly. We know that many concussions are unreported and not properly managed, putting the athlete at risk of a more severe injury. Parents can play an important role in identifying concussions. If you notice changes in personality or behavior, changes in sleep patterns, or lapses in attention, have your child evaluated immediately and report the situation to your child's athletic trainer. Protective equipment, such as helmets, headgear, and mouth guards, cannot prevent concussions. Such equipment protects against other types of injuries if it meets prescribed standards and is properly maintained and reconditioned. But neither you nor your school can buy equipment that will keep your child from suffering a concussion.
Catastrophic injuries only occur 50 to 60 times a year in all of high school sports, and that includes more than 7.5 million participants. Many athletic trainers work an entire career without having to deal with one, but the NATA cautions us to always be prepared for such injuries. We have comprehensive emergency plans in place, but athletes and parents play an important role in preventing these injuries.
Brain injuries occur in numerous sports, not just football, and helmets cannot prevent them. They usually involve a ruptured blood vessel in the skull cavity, but can also result from second impact syndrome, which occurs when an athlete returns to activity too soon after a concussion. Always inform your athletic trainer of symptoms like headache, confusion, dizziness, disorientation, memory loss, and other indications that you may have suffered a concussion.
This is another risk that is not confined to football and cannot be prevented by equipment. If you run, dive, or slide headfirst into another player, the ground, or any solid barrier, you can suffer a catastrophic neck injury. Following the rules, using proper techniques and safety precautions, and avoiding unnecessary risks, and keeping the head out of the game are ways to protect yourself from these life-changing injuries.
Heat illness is absolutely preventable in sports, but parents and athletes play key roles in this process. We do our best to assure that you are properly acclimatized and drink plenty of fluids during practices and competition, but severe heat illness often results from factors other than athletic participation. You must remain properly hydrated before and after sports activity, eat properly, get plenty of rest, avoid drugs and alcohol, and report any illness and any medication you are taking to your athletic trainer.
These events may be totally unpredictable, so we're always prepared to administer CPR, including the use of an AED, but some athletes are predisposed to problems. You must provide us with an accurate personal and family medical history, report symptoms, and follow all medical recommendations in order to participate without unreasonable risk.
Athletes with conditions like asthma, diabetes, hypertension, sickle cell trait, and even seizure syndrome may be able to participate but not without risk. By knowing your personal and family medical history and any medications you require, and if you quickly report any symptoms, your athletic trainer can properly respond if problems arise.
Lightning can strike without warning, even out of a clear sky, but usually occurs during electrical storms. We follow certain procedures when there is a threat of lightning, but athletes and spectators must quickly comply with our instructions to protect themselves. Activities away from our campus require special attention to these precautions.
We work closely with our athletic trainers to protect athletes from injury and particularly from catastrophic events. We can teach you how to protect yourselves, but once play begins, many things are beyond our control. We have to rely on you to follow our instructions, use common sense, and take responsibility for your own well-being.
The health and safety of our student athletes is our #1 priority. We do everything we can do to reduce injury risk. We know that high school sports are relatively safe, and statistics show that high school age students are much greater risk of serious harm from activities outside of school than they are in high school sports.
We need for athletes and parents to partner with us in the effort to reduce the risk of injury during sports participation. If we work together, your high school sports career will provide great benefits and enhance your life now and in the years to come.
Thank you for taking time to view this educational program. If you have any questions about anything you've seen, your athletic director, your coaches, your athletic trainer are always available to meet with you and discuss your concerns. Please take advantage of these resources and have a safe and successful sports experience.